Welcome to our Global Research Nurses webinar, Introduction to Research for Nurses and Midwives. Thank you very much for joining. My name is Arantxa de la Horra, and I'm a nurse and a midwife. I coordinate Global Research Nurses, and I will be moderating today's session. Next slide, please. Thank you. So just a few reminders. This webinar is being recorded and will be shared on the Global Health Network. Please use the chat box to introduce yourself, and please use the Q&A box to post your questions. All the cameras are automatically deactivated and microphones muted for participants. If you've got any technical issues, if you cannot hear or see us, please share your computer preferences. You might need to close all the programs and check your sound level. If the issue persists, you may need to close and restart the Zoom meeting, and otherwise you can let us know on the chat box and we will aim to assist you. Next slide, please. And our program for today. Today, I will start with this webinar with a presentation about the role of nurses and midwives in driving research. Then Jennifer McClellan will present where to start with clinical research. This will be followed by our panel discussion on the journey into research, sharing those tips that they wish they had known before getting started. And finally, we will open the floor to questions from the participants. So let's start. Next slide, please. So now we will start exploring the role of nurses and midwives in driving research. What is the role of research in nursing and midwifery? Why is it important? Next slide, and click next. Thank you. Let's start looking at the nursing process. We usually start off by assessing a situation. What needs does the patient have, or what problem does the patient have, or what potential need or potential problem does the patient have? Once we have assessed the situation, we plan what we are going to do about it. How are we going to intervene in this problem? What strategy are we going to follow? And then when we have planned what we are going to do, we do it. We intervene in some way, and this is the implementation stage. After we've carried out the implementation or the intervention, we evaluate how effective the intervention was. Was it effective? Did it work? Didn't it work? And then the evaluation fits back into the next round of assessment. The key thing that I would like you to notice is that when we implement our plans, we must be able to give a reason for carrying out that intervention. In other words, we need a rationale. Next. Just one click. Yeah. Now, if we've got a rationale, that means that we can be accountable for what we do. It also means that we can optimize our practice. The next question is, what do we base our rationale on? Next. Traditionally, rationales have been just based on practice. We used to say, we've always done it this way. The problem with practices is that they may be right or they may be wrong. Just because something is been done for a long period of time doesn't necessarily mean that it's the best thing to do. For example, hundreds of years ago, doctors used to bleed patients routinely, as the idea was to let the badness out. That wouldn't work now very well for many patients, but so just remember, just because things are based on practice does not mean that they are wrong. They may be right. We can't just say, we need a bit more information. Next, please. And then sometimes, to base our rationale, we use common sense. That means that we apply principles. It could be principles of physiology, principles of psychology. And while many of these common sense practices may be right, some may not be. Another example, years ago, nursing students used to be taught to massage pressure areas really vigorously with soap and water, under the rationale that this would improve the blood supply and therefore tissue viability. Now we know that if you do that, the area is more likely to break down into a pressure sore than if you don't massage the area, and that the right thing to do is to relieve pressure regularly. So even though it seemed to make sense, it was actually the wrong thing to do. And the problem is that our ability to understand how the body works is limited, and we can't always work it out using all these principles of common sense. Therefore, we should base our intervention on research findings. Next, please. Now, research has many advantages, and one is that it can look at a large number of cases as opposed to basing our practice on individual experience. We might think that just because one intervention works for one patient is going to work for the next patient, and that's not necessarily true. Research can look at a whole number of patients and try to find out what is true in the general situation. Then we can apply that truth for the general situation to our specific situation, and that's more likely to work. Research-based rationales give us the correct intervention because it's based on logical procedure that is being employed to work out what the best thing to do is. Next, please. But research is not just important in informing our decision-making for nursing care. Research helps solidify nursing as a profession. For a profession to be recognized as such, it has to have its own body of knowledge. And for many years, nursing struggled to be recognized as a profession. Evidence from research influences and shapes all our nursing profession, informs and underpins policy, professional decision-making, nursing actions. So research is key to advance and improve our practice. And also the fact that nurses are the health professional group, we are the health professional group that spends the most time by the patient's side, puts us in the perfect position to identify the gaps in care and pursue the answers to the most pertinent and critical research questions. And also don't forget that keeping in mind that nurses and midwives, we collectively are the largest healthcare professional group, that nursing research has the potential to revolutionize healthcare. Next slide. How can you get involved in research? There are many ways that you can engage in research. At a minimum, all nurses and midwives, we must be consumers of research by reading research reports to keep up to date with relevant findings that may affect our practice. We could be setting up research clubs in our units. And also important to involve patients and discuss the implications and relevance of research findings with them. And at the other end of the scale, nurses must be producers of nursing research, designing and leading research studies. Next slide, please. And how can we help you to get involved in research? Here at the Global Health Network, we support nurses and midwives to get involved and lead in research. Global Research Nurses is a community of practice, and our mission is to empower nurses and midwives to pursue a career that involves research, no matter where they work or the role they have. And what we really want, our ambition is to enable nursing and midwifery research leadership in low-resource settings. And Global Research Nurses is led by our regional coordinators, who are research nurses in Africa, Asia, and Latin America. And these coordinators organize research capacity strengthening activities in the regions, and you'll have the opportunity to meet them today. So as you can see in the image, we run from annual grant awards, competitions. We'll soon be advertising to recruit for more regional coordinators in Latin America, Asia, and Africa. We also offer access to the professional development scheme. That this is very key for anyone trying to get into research or developing research skills. This scheme guides and tracks your professional development in health research by capturing your core competencies, qualifications, and training in research. And as you can see, scholarship awards there, that's something that I will mention later on, but we've got a very exciting event coming up for November this year. It's the Burdett Trust for Nursing Symposium. And this will be a precursor to the Global Health Network Conference, also happening in November. It's just the day before. And we've got, we are really pleased to say that we've got sponsored attendance opportunities. So I'll mention more information at the end. But we'll be able to take nurses and midwives there and pay for the trip and the accommodation and the conference. And also, as Global Research Nurses is part of the Global Health Network, as a member, you can access all the available resources across the network. And if you would like to benefit from any of these opportunities, just sign up, it's free. And the link will be in the chat, or maybe it's already been posted. And you can also follow us on Twitter to get instant notifications of training and research updates. And just before I finish to summarize, remember, nurses are best placed to identify the gaps in care. And nursing research has the potential to revolutionize healthcare. You can get involved in research in many ways, and we are here to support you. So I hope that's the end of my presentation. I hope this has inspired you to get involved in research. And now I'm very pleased to introduce Dr. Jennifer McClellan, a qualitative and mixed methods researcher at the University of Oxford. Dr. McClellan is a nurse and a midwife with a background in public health, humanitarian response, and research delivery. Dr. McClellan, the floor is yours.
Great, thank you. I must just say how exciting to see everybody saying hello in the chat from all over. It's just absolutely wonderful. So thank you for inviting me here today. I'm just going to use some brief slides. If I can press go. Yes, here we go. I think you ended beautifully, Arantxa, by saying nurses and midwives are absolutely in the perfect place to identify gaps in care, gaps in services, to stimulate research questions and the need for research to improve care. So that's where I pick up. Where do you start? So you're in practice, you can see where things may be done better. So what do you do about it? Well, as we all know, research, it's a process of steps. It's really very straightforward. We use these steps to collect and analyze information to increase our understanding of a topic or an issue. So to do that, what do you start with? Well, you ask a question, don't you? And then you collect the data to answer your question, and then you present the answer to your question. Doesn't that sound really simple? Well, it ought to be, but of course, yes, there's a few more things you need to do along the way. So first off, how do you make a research question? This is actually more tricky than you think, but how you ask the question then determines how you collect the information. So I've given 3 kind of general examples here. First off, if you want to explore something new, for example, to explore the process of decision-making among midwives about when to perform an episiotomy in a normal birth. So in this study, we wanted to look at, okay, midwives, how do you make that decision? What influences your decision and impacts you making that decision? So another way to frame a question is if you wish to measure an effect. So for example, does home monitoring of blood pressure in pregnancy lead to earlier diagnosis of pregnancy-induced hypertension? So we're not exploring a topic, we're wanting to measure something. So what's the impact of this home monitoring of blood pressure on the earlier diagnosis, the timing of diagnosis of pregnancy-induced hypertension? Does one impact the other? And then again, comparing between variables, this is a lot more quantitative, and I must confess doesn't sit dreadfully comfortably with me, but an example could be about digital health literacy and how does that impact on your use of online triage services, which are, you know, the latest attempt to, you know, ration healthcare really and direct people around the health system in England, definitely. So once you've got your question, your how, why, what, you're going to choose the method. So I work in qualitative and mixed methods because my belief about the world is that everybody's experience is different and that it's very difficult to measure something objectively without the influence of context and, you know, a person's own perception and experience. So I always go for these exploring ones. So that obviously means qualitative methods to capture experience and perceptions. So for example, in that midwifery study I spoke about, one might do, or we did, interviews and focus groups. So we asked midwives, okay, how do you make those decisions? What happens if a woman presents like this? Chat me through what goes through your mind. What resources do you draw on? What informs your decision making? So we're really exploring and building up an experiential model. Now, in some cases, mixed methods can really strengthen what you find in terms of impact. So a very good study to show as an example for that is measuring with numbers different staffing levels on an obstetric unit and caesarean section rates. Now, this is quite a famous study, and it found that caesarean sections were more likely to be performed on the weekend, but the most senior staff are not present on the weekend. And so the question was, well, why is that? The more, the registrars are doing caesarean sections more often. So they did some qualitative work, and they spoke to these medics and midwives and said, what's happening here? What's the difference with the weekend? And they found that the risk tolerance of the more junior doctors was lower than the consultant. So the consultant would sit and wait and say, no, I think we're okay. We can go a little bit longer. We can try, an instrumental birth rather than going for section. I think we're okay. There are other things we can do. Whereas the registrars were more likely to go straight in with, okay, I'm not happy, let's just go for caesarean section. So that was quite interesting and led to interventions to upskill these more junior doctors and to have more senior coverage on the weekend. So the measuring, comparing questions, again, classic cohort study of Doll and Hill, where they followed a group over time. They're measuring over time, and this was actually the impact of smoking on lung cancer, and they found that the group that smoked got lung cancer and the group that didn't. And so that was really seminal in making that link. And then of course the testing in a trial, which we're all too familiar with in medicine. So I just wanted to show you two beautiful qualitative studies to show you just the strength of one, finding the gap and asking the question, but also what you can learn from doing qualitative research. This one, using traditional healers to treat child malnutrition, a qualitative study of health-seeking behaviour in Eastern Ethiopia. So in this context, the health professionals were seeing mums bringing their young children, their under fives, into the health centre with very severe malnutrition. And they were asking, basically, why did you delay? Your child is almost unresponsive. Why didn't you come earlier? And so this beautiful qualitative study spoke with women and the lay health workers in the villages in the rural areas. And they found the context around this health-seeking behaviour that, first off, the health centre was very far away, and often the family didn't have the money to travel there or to stay there for the extent of the treatment. Equally, it was described as being quite stigmatizing to have a child with malnutrition. And so families would go locally to the traditional healer to see if they could fix it. They would use other narratives such as parasites, of course, for the swollen tummy. And there were some other traditional beliefs about certain birds that fly over the pregnant woman that has caused her child to be swollen in this way. And finding and recording these beliefs. This hasn't been done yet because it's a recent study, but that can then allow the health professionals to understand the mum's perspective, and then hopefully, refine their intervention to enable mums to come forward a bit earlier, or for the health professionals to go out and meet the mums. Another interesting one was a mixed method study of maternal near miss. This was a hospital in Somaliland. So the professionals were extremely skilled at doing caesarean sections for emergencies, but they found that the complication rate was very high. So the women were still having, serious bleeding or even dying. And they thought, this doesn't add up. So they did some qualitative work. They did interviews with the health staff, with women, and they found, and this is just wonderful, they found that the person who would give consent for the mum to have an operation was not always the person that accompanied her to the health post. And so on those occasions, the family member that had come with her, for example, the mother, the sister or brother, had to then return to the woman's village and get the permission from, often it was her father or the head of the village, for her to have the surgery. So that delay, while they went back to the village and then back to the hospital, was often critical. And excellent insight into how a fantastic service just wasn't actually working. That is all that I've got there. I think the actual doing of the research can come later. I think it would be wonderful if we can listen to our panelists now about their experiences of how they formed their questions, got into research, and what they wish they would have known.
Thank you, Jennifer. It's really, it really brings to light how each method complements each other to get to understand the problem, because it's a multidimensional problem, aren't they? Thank you, very inspiring. Now I'm pleased to introduce our discussion panel that will take us through their journeys into research. Today, we've got Dr. Mary Annie Ampasa, a senior lecturer at the Maternal and Child Health Department, the School of Nursing and Midwifery at the University of Ghana. We've got Lydia Boampu Ogusu, a lecturer at the Department of Nursing, Wame Nkrumah University of Science and Technology in Ghana. We've also got Faith Nawagi, a PhD scholar at Makerere University and winner of the Nursing Now Challenge Global Research Award. Ralueki Ekisie, Global Research Nurses Coordinator for Africa, an entrepreneurial nurse in Nigeria. And Mr. Joby George, Global Research Nurses Coordinator for Asia and Senior Nurse Coordinator at the Institute of Critical Care and Anesthesia, Medanta de Medicity, Gurgaon, India. So first, let's start with Dr. Mary Ampasa. Mary, the floor is yours.
All right. Thank you very much, Arantxa. Can you hear me? Great. All right. So thank you, Jennifer. That was a very nice walking into what we're going to discuss at the moment. So my journey into research began at a point where, as I journeyed through my nursing education, at the same time, I combined my training with practice. Now, when I got back into practice, there were a couple of things, like Jennifer did explain earlier on, around questioning why cesarean beds were quite kind of common around certain times of the week. It was a similar situation in my case. I was at the NICU, and at the time, we saw a rapid increase in the number of birth asphyxia and the number of umbilical cord sepsis. So, but I just knew these cases were rising, but I really didn't know what to do. Now, coming back to what we're discussing today, I looked back and I said, how I wish I knew what I know now. And so my journey into research and what I wish I had known is basically around four things. I wish I had knowledge about the essence of research as a foundation to improve practice and health outcomes, influence policy, and be able to understand that research is a foundation to directing change at all levels, and as also foundation to create sustainable solutions. So in the first presentation by Jennifer, she gave three basic things around, okay, so what is happening here? What can I do about it? How can this research come in to solve problems? And I wish I knew that research was the core, it was the foundation to solving these problems. I didn't know that at the time. And so if you're on this platform, I am so glad that you're in today and you can carry home something. I also wish I had known how to even access information. So I started with my basic nursing school, right from the nursing training college, way back in the 90s. And of course, I didn't know about databases. I didn't know about how to search for information. I didn't even know where to look for information. And so what I wish I had known also centers around the various research processes. How do I even tell my story around umbilical cord sepsis? Where can I go for information to tell the story about what is happening even in other facilities or in other places? And how can I tell my story in here? How can I bring the information together, juxtaposed with information out there from peer-reviewed literature versus the gray literature? How can I bring all these together? How do I even write my lit review? How do I even, these are basic things that I thought, at least even if I didn't know the steps, if I didn't say about the processes, even if I didn't know the steps, at least I could have a good understanding around the fact that, okay, I need to write my background, I need to search for information to write my lit review, I need to articulate and have a thread along to the meta section. I also wish I knew that all these was about collaboration. So research, there's a problem out there, and it's not just about me, but it's about us. The social relevance of research requires a collaborative approach. I can be seeing this from my angle, but how else is this impacting other people? How else is this being seen by other members of the healthcare team? How can we come together as a team to use a holistic approach to solve these problems? And the final thing I wish I had known was to also have a good understanding that it was a skill I needed to conduct at least basic research, sound research, and be able to disseminate my findings, not necessarily a publication, not necessarily get into big conferences, but also be able to disseminate these findings even at the facility level. And to understand that research is doable, is fun, and it's just not scary at all. In fact, it's a lot of fun. Thank you very much. I don't want to exceed my time, and I'll pause here for you, Arantxa. Thank you very much.
Thank you, Mary. Very inspiring. Now, I'm really pleased to introduce our second panelist, Lydia Wampogo-Busu, a lecturer at the Department of Nursing and Kwame Nkrumah University of Science and Technology in Ghana. Lydia, the floor is yours.
Hello, everyone. Good afternoon, and I'm glad to be part of this webinar. I'm here to share my journey through the research continuum. So this will be the outline of my presentation. I'll talk about how I started, moving forward, some challenges, and give you some tips. So how it all started, when I started my nursing career, just like Dr. Eni Amponsa started, I kept asking questions. I kept seeing conditions, and for a particular season, you see a particular condition, they keep coming. And I kept asking, why are they coming at this time? What is prevailing in their community that could predispose them? How can we help them? And how can we locally manage them successfully? And all these questions I kept asking, and I didn't have any answers until I started doing my first degree, then my master's, and then I started reading literature on what others have done. And that is where I started a bit of research here and there. But then what stood out for me was that reading what others have done, looking at academia in nursing and midwifery, I realized that we do a lot of researches. Before you graduate from any nursing school, whether bachelor's, master's, PhD, we conduct research. But then how are we implementing the findings of these research? So asking this question led me into my PhD study, where I'm researching into the utilization of research findings in clinical practice. And along the line, fortunately, I got sponsored by the Global Research Nurses to participate in the Qualitative course in research. Now, my main challenge, where do I start from? I had the questions, I had an idea. I knew I wanted to do something, but where do I start from? And so after my bachelor's, I got a supervisor, a professor emerita, who was very good. And so I contacted her one day and I said, I keep having these issues and I wanted to do something about it. And so from there, she gave me some guidance here and there. And then coupled with my master's supervisor, I started active research. And then sometimes the question is funding. How do I get funding? Who is going to support it? Because research really comes with a lot of cost and you need funding. Fortunately, we have global research nurses here to support. What I wish I had known earlier was in my early stages in my career whilst at the clinical area was the need for research. You cannot always use the knowledge that you gain from school. You need to find out what is trending, what has changed in our career, what has changed in our practice, what is the new trend in our practice. There are several conditions coming up. How do we manage them? I wish I knew all of these. I wish I knew how to search for information, just like Dr. Niamponsa mentioned. I wish I knew I had much knowledge regarding the various research methods to know that, no, when I'm looking for experiences, I would want to use qualitative. And when I'm looking for generalization, I would want to use quantitative methods. And then again, the need for collaboration. You can't do it alone. You don't know it all. And so I wish I knew that I could count on certain people, link up with certain people to be able to move on in my journey. Now, these are some of the tips I would want to share with you. First, you need to identify your area of interest. We have general nursing, we have general midwifery, but which area is of interest to you? Identify it. Get people who are already in that area and link up with them. Identify mentors, people who have successfully navigated their way through the journey and work with them. Collaborate with others. Start from somewhere. You cannot know it all before you start. Definitely you must start. So just start from somewhere. Attend webinars like what global research nurses is doing. Attend them. You get to meet people who have started and you get to learn from people's experiences. And then you also get to collaborate with others there. Read other people's research articles. Whilst reading, you get to know the gaps in literature. You get to know the problems that are prevailing in our society. You get to know some of the interventions people have implemented, and then you'll be able to pick up from there. Again, be ready to serve others, be ready to work with experienced people, be ready to submit so that you can learn. Surround yourself with like-minded people. And finally, make sure you follow global research nurses because they have a lot to offer nurses and midwives. Thank you very much.
Thank you very much. Thank you, Lydia. Very inspiring. And thanks for sharing your journey. Now, I'm really pleased to introduce our third panelist, Faith Nawagi. She is a PhD scholar at Makerere University in Kampala, Uganda. She is also the African representative for the Foundation for Advancement of International Medical Education and Research. And she is also the winner of the Nursing Now Challenge Global Research Award. Faith, the floor is yours.
All right, thank you so much. And thank you everyone for attending this session. I'm pretty much going to have a dialogue and not use slides so that we can enjoy the entire sharing. My journey in research, quite frankly, begins when I'm in school. While many people began their research careers later, I began my research career at my undergraduate level. I think I was a second-year nursing student at Makerere University, and we had the Research and Writers Club. I joined that club. It opened up more opportunities for training in research, opportunities in networking, opportunities in learning everything about research and all that. And also opportunities to learn how to write grants and also scientific writing. So along the way, I was able to write mini grants when I was still a student and win them and implement them and do the research and things like that. So I went ahead to graduate and later work at the Johns Hopkins Research Collaboration here, where I was the study manager and coordinator at the point in time. And later on, I've always evolved to be into academia, where I teach nurses how to conduct research, especially in the domain of global health. And also, I've also been able to write my own grants because I believe as nurses, many times our contribution in research is to be the people who are collecting the data. But to me, I think nurses are at the front line and they're the best people to provide evidence because they are at the front line. So in that regard, I've always written my own grants, and it's not that easy and all that. So one of the questions that I'm asked to discuss today, what is it I wish I would have known before I started this entire research journey? Unlike other people where they didn't have mentorship, they didn't have training, quite frankly, I had all that. And what I wish I would have known, I wish I would have known that predator journals exist. These are journals that are not authentic, and they will take up your research and all that in a form of a book or anything. And at the end of the day, actually your paper doesn't make impact because they are money driven and they're only available to a certain market, which may not be actually medical and all that. So I wish I had known that, because I think my first research, I made a book which has never been read, but it is all there and things like that. I also wish I had known that actually becoming a good researcher is a process, just like becoming a good writer. And you can only become better by doing research. So I always thought I should learn everything and be, but along the way I've learned that you can't learn everything at one point in time. You get to learn as you do and as you proceed and all that. So just a little tips on how to move forward. I think it's very important for us as nurses to believe that we can be principal investigators, colleagues, and not just the people that are doing research to collect the data. We are knowledgeable, we are the front line. Let's believe in ourselves that we can actually have research questions generated by us that would actually be answered through research led by us, and eventually it can lead to policy development. Also, we need to plug ourselves into different networks that can give us support, be part of academia as well, ensure you update your knowledge and things like that. That's why I'm doing my PhD, because I really need the entire grounding to this skill and all that. I also think research goes along with academia and policy and eventually health outcomes and things like that. So to me, I also think as we do research, we must appreciate the component of translational science, whereby our research is not just kept at the bookshelf or published and that's it, but how do we ensure that it actually gets to impact practice in the day-to-day? It's entirely a long process. There are lots of culture and organizational barriers to overcome, but let's be bold to take up that step as well. Thank you so much, Arantxa, and over to you.
Thank you. Thank you, Faith. I like the sentence, nurses are the best people to provide evidence. That's very inspiring. Now, I'm really pleased to introduce Ralweke. Ralweke is our research coordinator for Africa based in Nigeria. And Ralweke, the floor is yours.
Hi, good day, everyone. I hope you can hear me. And hola to all you from Nigeria and all African areas. Welcome to this program. I am still Ralweke Ikezie. I am the African Regional Coordinator for Global Research Nurses. And I am a nurse entrepreneur. I have a home care agency called Blue Touch Home Care Limited. And I'm glad to be with you today. So I'm just here to tell you a bit of a story of how all this started. So back in, I think 2012, when I had my home care agency, I've always been enthusiastic about research, and people kept coming that they are writing projects and programs I want to research on home care. You know, it became something that it seems the university were pushing people across to my agency to, you know, do their research. So in 2014, I had to got to hear about a program organized by the Global Health Network that was in Abuja, Nigeria. And I tripped there to participate in the program. And then somehow, I became the only nurse in the program, only nurse. And this was organized in a in an institution where nurses are the majority of members. I think I met Tamsin there, who then took interest, the only nurse, and I wasn't in the city. I had to trip from Enugu to that place. So that was how I started the journey. And then through that, I've been able to do a lot of programs for nurses in Africa through webinar. I've been in 6 geopolitical zones in Nigeria, training up to about 2,000 plus nurses in clinical research nursing. One thing I noticed in my journey is that here we talk about research. However, clinical research knowledge is quite lacking. So, and I took interest in that because that is one thing that is needed for people who are practicing in the hospitals, for people who are practicing in the clinical areas. So my project is mostly as a clinical research educator. So over the years, I have been able to meet some people who helped me along the way. Nicole Arancha, Elise Peterson, Liam Boggs, Bonnie Baker, Elizabeth Allen, quite a lot of them that's helped me to navigate through this journey of clinical research knowledge. And then this has also taken me to quite a lot of places, being in SA for clinical trial conduct courses, learning and networking. And one thing I think all nurses here who are participating should know is that you don't need all the certificate in the world to start. I started as an RN. So I want to motivate you today to look for a way to start the project, to start the learning, and to start the process of being a research nurse. And then also, I also want to use this opportunity to tell everyone who is here that Global Research Nurses is a very welcoming institution or organization where you can always be able to get mentorship. If you are in Africa, you can always, get across to me and I will put you through. So I think mostly you have all you need down here because I am here. And I believe the other persons in the Global Research Nurses family are also here to help you. If there are other questions you may want to ask, you can ask it out. Thank you.
Thank you, Ranwiki. Thank you. It's lovely to hear about the start of your journey with Global Research Nurses before even I joined. And we'll leave the questions for the end. Just please write them down, any questions that you've got in the Q&A. And now I'm really pleased to introduce our 5th panelist, Joby George. He is the Global Research Nurses Coordinator for Asia. He's a Senior Nurse Coordinator at the Institute of Critical Care and Anesthesia at Medanta Medicity, Gurgaon in India, and he has been part of the team for over 10 years. Mr. Joby, the floor is yours.
Thank you, Arancha, for this warm introduction. Glad to be one of the panelists for such a great day for nurses, and I think that it is the attendees, the number of attendees itself shows that how the nurses are interested in participating in the research. So that's a great enthusiasm and a great number to see that. And my journey from bedside to the research nurse was indeed fascinating, rewarding, at the same time challenging. I was practicing as a bedside nurse, so then after practicing there for 2 years, I transferred to one of the BAB, one of the bioavailability and bioequivalence center, and started my career as a research nurse. So from there, I started that how the research is pivotal in the patient care. So that is the reason that I transformed myself from a bedside nurse to research nurse. And since 10 years, the journey is indeed rewarding. After I got involved into the Global Research Nurses Network in the year 2011. I conducted the first ever research workshop in Delhi NCR in that time with a massive participation of 500 nurses. So from there, I realized that nurses are one of the key pivotal factors that have been involved in the research. And from that day onwards, I've been started working as a research capacity development for the nurses. Until date, it has been indeed my great honor that we have conducted around the skills and the research sharing workshops in many parts of the India. And it is still continuing also. So many a times, what as a bedside nurses, the nurses always have many questions to ask, but they don't know that how to address those questions. But as I can say that why for all the answer to those questions were answered when I started my career as a research nurse. I was practicing as a nurse, so then I was thinking that why the pressure ulcers always happen when the nurses are changing the position of the patient every 2 hours, and they are maintaining every preventive strategies. So then that questions triggered me in my career as a bedside nurse. The answer to that question revealed when I started my career as a research nurse. I collaborated with the European Pressure Ulcer Advisory Panel, and then I drafted a data collection form. I initiated a research protocol. I get it approved by our institutional ethics committee, and we conducted that research study. And we found that many confounding factors are there, apart from what we are thinking. So the answers to the unanswered questions will answer in as a research nurse, what I believe. So therefore, this is indeed a great opportunity for the nurses to get involved into research. And I think that the Global Research Nurses Network is one such digital platform that is available for you anywhere, everywhere, at any point of time, absolutely free of cost. And as a regional faculty of India, any research capacity development programs, if you want to conduct in your region, we are very much happy to support you at any point of time. So let's accelerate research through Global Research Nurses Network. Thank you everyone for your valuable time. Have a nice day. Thank you.
Thank you, Jovi. Thank you very much. And now, before we move to the Q&A section, so if you've got any questions for our panelists, please write them in the Q&A box. We have a question for you. We have a poll question for you to complete. It's next slide now. Yeah, there we go. So it's going to come up as a question for you to complete as soon as Adam launches the poll. Yes, there we are. I can see now. So what would you like to know about research? There are some options there, but just think outside the box. And if you've got any of the suggestions, please write them down in the chat box. This will help us to be able to provide what you need in Global Research Nurses, because what we are here is to support you in your research journey. So just tell us what you need, what you like, and any other ideas are really welcome. We love to hear new things that we haven't thought about. And as soon as we get, oh yeah, we can see the responses coming up, and you can take as many as you think they're suitable. So if anyone would like to ask questions, please add them to the Q&A box. Yeah, I can see some of the entries in the chat box. That's brilliant. And we have been looking into how to write grants. That's something that we've run before. So we've got 53% of the participants completing. We'll give it another few seconds. %. So maybe we can leave it open for a little bit longer while we start introducing the Q&A session. And Adam, just finish the poll when you think is okay, when we stop having any more responses. So, and thank you for taking part in the poll. Now we will open the floor to questions from the audience. And we may need to go into the next slide, into the Q&A session slide, if everything can happen together in the computer, probably not. But so we've got some questions from the audience. There we go. And I'm just going to close this down. So we've got a question from Ibrahim Duakalu. He says, I would like to ask why qualitative methods are more prevalent in nursing than any other health sectors. And then there was another comment from the same person saying, as a follow-up, every method has its limitations, but if nurses are often using qualitative methods, it would mean that we have a shared limitation within our shared body of knowledge. Who would like to answer this question?
I can go ahead, Rancha.
Yes, please.
Okay, so it's quite interesting around that observation. I must say that we do have a fair distribution of nurses in both qualitative, quantitative, and now even in mixed methods research. So really, one of the reasons why you have lots of nurses in qualitative research, like Jennifer did say earlier on, that when you want to explore, particularly when very little is known about an area or when very little is known about people's unique experiences, like Jennifer said earlier on, the context really matters. And you're getting into care for patients within the understanding that every patient is very different. So if you're looking for people's experiences or you're exploring, and there's a noise from the background. So when you're having to explore patient experience of say, living with pain or managing umbilical cord sepsis, every child is different. I mean, this very example that we saw about malnutrition, traditional birth attendants' experiences of managing malnutrition. If you were to do a qualitative inquiry, you will understand that the context impacts even the manifestation of some of these conditions. So it is not because it's easy. It's not because it's unique to certain people, not because we use a qualitative approach just to be able to tap into, get in-depth understanding, have a deeper exploration capacity, because you cannot use quantitative for that. So you need to be able to think about what kind of research question you have, and that can guide the kind of research approach you need to adapt. So it really isn't that it's easy. That's why nurses are getting into qualitative. I would not even get into that. But what I'll say is that we do have nurses using all kinds of research approaches, but that is just that it depends on the kind of research question you have. And the reality is that for a very long time, we've had numbers driving the kind of things we do. We've had lots of figures, facts, but how about the context? How about people's unique experiences? How about the subjective experiences? How does that inform how we get about even managing pain? How we get about even positioning patients living with different conditions? So that is what I would say, Arantxa. Thank you.
Thank you, Mary. Thank you for answering that question. I was looking into the questions about sharing the slides. This recording is going to be made available at Global Research Nurses, and I will mention that at the end. So don't worry, you'll be able to access this and view again the webinar. There is one question, this is tricky, but it's interesting as well. In a situation where there is a visible problem that one wants to research about, what should you do in the absence of sponsors or grants? That's a very tricky one. Anyone would like to answer that one?
Sure, I want to give that a shot because I've had such a scenario myself. I think I really wanted to study the domain of elderly health, and there was no funding and no sponsors and all that. So what do? You write your idea down and you develop it into a proper scientific protocol. You keep applying, you don't give up on the idea. You keep applying for grant funding. And then at one point in time, someone will believe in the idea and then they give you funding. So what do? You write your idea down. The moment you write it down in a scientific way, you're able to keep on the momentum by using that scientific document as a starting point for grant application and things like that. It may take years, but it comes through eventually, actually. Yeah.
Oh, thank you, Faith. I'm unmuted. Can you hear me? Yeah. Thank you, Faith. It's a very good answer, because I think this is the situation that most researchers may find themselves when they're starting. So that's really good. I think we've got time for just one more question before we finish. So I'm just going to, there is a lot of
Arantxa, can I add in to Faith? Yes, please. Would you mind? I'm sorry to interrupt. Because I've been frequently in this position where I feel I've got a good idea, but I haven't been able to get money. And often I've started very small. So exactly as Faith said, written it up as the proper scientific protocol and document, because often you'll probably have to get ethics anyway. But maybe you can scale back your design. So you can do a small portion of it first. And then when you go for the money, you show even more evidence and willing and a track record of, look, I managed to get this. So I did that with a perineal study, looking at midwives' competence in perineal suturing, and very much did it as a professional development project with the approval of my manager. And on the back of that, got funding to do another piece, the next step piece of work. So that might be a way to do it too.
I would also add to that, and this is one of the topics that we are going to include. Maybe we can go to next slide, Adam. Strategic networking as well. So you've got your idea, and if you cannot get funding with you, join forces with someone and start getting to meet people, and that might get you there faster. We cannot see it in presentation mode. There we go. I think we are just going. Oh, that's me. But maybe Adam just mentioned that there was something happening to his Zoom account. So I was just going to mention, and I'm going to do this without a slide, just before we finish. Let's say, thank you all for all the participants for all your questions. We'll try to answer some in the chat that we've got now, and we'll definitely collect all the feedback that you've had to prepare our next session based on what you need the most. And now I would like to invite you to join us at the most exciting event of this year, the Burdett Trust for Nursing Symposium. This will take place, as I mentioned, on the 23rd of November in Cape Town. And this symposium will be the precursor of the Global Health Network Conference 2022 on the 24th and 25th of November. And we are just going to put the link in the chat now. The focus of this symposium, it will be strengthening nursing and midwifery research leadership in low resource settings. And we will be announcing further details in the coming weeks. We're aiming to announce this probably by the end of the month. What is exciting about this is we are offering scholarship awards that will support attendance for nurses and midwives from low resource settings. And as I said before, priority will be given to applicants with an abstract accepted for a poster or oral presentation. And the abstract deadline has just been extended to the 10th of July. So it would be great if you could get your abstracts in. And I think one of the areas where we had less abstract was in women's leadership in research. So just a tip, because that's the one that we had the least numbers, less competition there. And now, next slide. And now is time to say goodbye. Thank you. We've reached the end of the webinar. I would like to give my sincere thanks to all our special guests, Dr. Jennifer McClellan, Dr. Mary Eni Ampusa, Lydia Wampokowusu, Faith Nawagi, Ralweke Kesia, and Mr. Joby George, for your time and for sharing your expertise today, and to you, the participants, for your engagement, and to our team, Adam and Lena, for all the work in the background. And also, please help us develop and improve global research nurses by completing the feedback form that will follow up this event. And a quick reminder, as I said, this lecture has been recorded and it will be available soon on globalresearchnurses.tghn.org. And so, to close today's webinar, I would like to once again thank the speakers, the audience, and wish you all a lovely rest of your day. Thank you very much.